G'day and welcome back to the channel. So in today's video, I want to take you through perhaps the single best shoulder stretch that I've ever seen as a physiotherapist over the last 15 years. And that's basically a shoulder capsular stretch. So this will be different to probably 99% of the stretches that you'll do in that it doesn't target the muscles around the shoulder. It targets the deepest layer of soft tissue, that shoulder capsule that surrounds the shoulder joint or encapsulates that joint. And when it's stiff and restricted, it's prone to severely limiting the amount of range of motion that you have through the shoulder. So it's often a heavy contributor to a lot of shoulder pain syndromes. But obviously if you've got frozen shoulder or adhesive capsulitis, or even you've had some surgery recently and you're post-operative, that shoulder joint capsule can become stiff and tight and sort of create a bunch of shoulder dysfunction that you don't deserve to have. So this exercise is fantastic for three main reasons. The first is that it's easy to do, and when we get to it, you'll see how easy this is. The second is that it will benefit literally everyone. So if you're someone who has had a frozen shoulder or you're post-operatively recovering from shoulder surgery, this exercise will be fantastic for you at some point. The only disclaimer I'll put on this is it may not be perfect for you right now. You may need to wait a little while until you've healed a little bit or your pain's reduced a little bit, depending on your circumstances. So please consider speaking to your doctor, speak to your physiotherapist or your physical therapist, just so that you know when the best time for you to do this is. But for most people, if you're someone who is a recreational athlete or just someone who wants to get better shoulder function day to day, you deserve to see an immediate benefit from this straight away, which is point 3. So it's easy, anyone can and should do it, but it gets results quickly. So as we say on this channel a lot, you deserve to see an immediate change from any stretches that you tend to do day to day. It's not good enough anymore to promise you that if you keep doing these stretches, eventually you'll feel looser and looser. It's not good enough because we have a set of exercises these days that make genuine, immediate, tangible, observable change. So you should be able to walk away feeling immediately different. So what I want you guys to do before and after this exercise is go through some shoulder movements or a shoulder movement that you want to get better at, or you're having trouble with. Do that movement first, get a general sense of how it feels and how far you go. Do this exercise and then immediately recheck your movement, and you deserve to see an instant change. So please let me know down in the comments after you've done this what you found from doing the exercise, because if you didn't see a change, please go back and rewatch how to do the exercise and just double check that you're doing the right thing. But let me know otherwise, because we might be able to problem solve why this exercise wouldn't be working for you, when my expectation should be or would be that it should make a big difference for you straight away. So getting into the exercise, what we're going to do basically is we're going to do this exercise on our hands and knees on the floor. It's the best way to do it, but if you're someone who struggles to get down on the floor or you don't want to get down on the floor, you can do this very same exercise on a bed. You can do this with your feet on the ground, leaning up onto a table or a bench. The technique's the same, and I'll talk you through how to do that quickly at the end, but the ideal is to do the same technique in whatever situation you feel best in. So what we're going to do basically is we're going to get you onto your hands and knees. Now before we do this, obviously, what I'll get you to do, as I said, is we just want to make sure that we check your range of motion. So for me, I'm going to do my left side, and just for the purposes so everyone can see here, keeping my rib cage down, I want to lift my arms up as far as I can possibly go. So for me, this is as far as I feel comfortable going without cheating and bending through my trunk. So please take a mental note or pause the video and just get a sense of where my shoulder is here compared to this one, where it is compared to my head. We're going to reassess this afterwards so that we hopefully see an immediate change. So again, the exercise is basically getting down onto your hands and knees. Now it's really important that you keep your shoulder blades back. So we don't want you to feel like you're reaching forwards with your shoulder blades, because what that basically does is it introduces another joint into the exercise where we're specifically trying to target the shoulder joint itself. By keeping your shoulder blades back, it's much easier to target the joint capsule in this area of the shoulder. So please try and drop your chest sort of between your shoulders, get those shoulder blades as flat across your back as possible. And all we want to do here is keeping your shoulder and your hips connected. We just gently want to shift your body weight over the shoulder or over the hand of the side that you're trying to stretch. Now, a lot of people make the mistake of turning this into a stretch where the further you go, the better it is. That's not actually the case, because if you can keep your shoulders back and then keep your chest sort of level with the ground, you should find that after a few inches or 5 to 10 centimeters, you should start to notice a pressure going through the back of your shoulder. And the idea with this exercise is you want to imagine that your arm bone is gently pushing out the back corner of your shoulder as it meets your shoulder blade. And what you'll find is in a very short amount of time, you should feel like there's a gentle pressure occurring there. That's exactly what we're looking for. Now, if you're feeling a little bit of pain or discomfort at the front of your shoulder, that might mean that your shoulder joint is impinging or catching a little bit. So if that's the case, just come off that a little bit more. So don't go as far over the top of your shoulder. Don't be 90 degrees, drop off a little bit. Just try and find a position or an angle that takes the pressure off the front and puts it squarely at the side of that shoulder, which is what we're looking for. And all we want to do is hang out here for 30 seconds, 60 seconds, a minute, 2 minutes, whatever you feel comfortable with. Now, the variations to this, and we'll go through 2 variations to this to make it a little bit more specific. But before we do, obviously, if you are someone who doesn't enjoy getting down on the ground, we want to make sure that you still recreate this shoulder position. So if you are up onto something, it's the same idea, but you're just doing it from a different angle. Now, when you're doing it standing up, for example, you might need to do this next variation to get more out of the exercise. But once you feel comfortable with this, the way to progress this a little bit further is to do this on your elbows. So just, again, it takes the elbow out of the equation, allows you to put more force specifically through that shoulder joint capsule. But the same rules apply. So you want your shoulders comfortably back. You just want to shift your body across, go hunting around until you feel a really nice amount of pressure through that part of the shoulder. We want to hang out here for as long as it takes for you to get sick of the exercise. Now, what we can do on top of this is a lot of people tend to be stiff in different ranges of their shoulder. So if we want to bias that internal rotation a little bit more, then if we just gently bring our other hand, rotate that around, making sure that we maintain a good shoulder position. By doing this, we're going to hit a slightly different part of that shoulder joint capsule that we're not going to hit if we're here or if we externally rotate that shoulder. Now, just be warned that if you do internally rotate that arm a little bit more, you may be more inclined to feel that pinching. So just make sure that you come out over the top of that. Find a position that doesn't jam that shoulder up, that still puts that pressure through that area. And then again, the great thing about this exercise, coming back to this, as I said, is that immediately you should hopefully see that things change. So hopefully what you'll find if you go back and check out this, how I did this the first time, it automatically feels looser for me. It feels like I have more range of motion to go back before I have to cheat. So getting my other arm here as well. This one still feels very similar. This one feels a little bit looser. And then checking it out on camera, I think I was sort of here to begin with. I'm very fortunate that I'm flexible to begin with, but I just want to show you that instantaneously you should feel like that shoulder moves better than it did before. Now, if you want to take this another step further, we can use a power band to really pull apart that shoulder joint capsule and get even more out of this. So the easiest way to do this, obviously, is to tie it to something that's not going to move. We want to slide the band all the way up into your shoulder so that it's pulling sideways, it's pulling that shoulder apart. And then obviously we want to set up in the same way as we did before. So elbow on the ground or hand, depending on what you feel comfortable with. Have enough tension on the band so that when you come back across that, you still feel that there is some tension there and some pressure on that joint. This is a brilliant way to, I guess, to make the shoulder joint exercise, the capsular stretch, even better than it already is. And when you're on your elbows, it's much easier to be on your elbows on a table or a bench. The one thing that a lot of people do is a lot of people end up in this position where they're pushing straight up. But we want to try and push more towards the back of the shoulder. So what I'd recommend that most people do if they're standing on something is to stick your bottom out a little bit more so that you're still a little bit more sort of horizontal as opposed to vertical. So you get a little bit more pressure to the back of that shoulder. So as I said before at the start of the video, this exercise is one of the best shoulder stretches that you will ever do, provided that your shoulder's in a good position and you're not jamming anything up at the front. If all the pressure is at the back of that shoulder, you deserve to see instant progress irrespective of what you're going through. Obviously, if there's pain involved, you might find you may not be able to go as far into that motion before you get pain. So don't go to pain, stay within what feels comfortable to you. But if you're not sure, take this to your physical therapist, to your doctor, to your physio, get them to sort of tell you when the appropriate time to do this might be. So with that being said, I really hope that was helpful for a lot of people. As I said, it's generally one of the best things that I have seen in terms of getting rid of shoulder joint stiffness, improving range of motion quickly. It is an absolute godsend to anyone who's going through a frozen shoulder or adhesive capsulitis or post-operative joint stiffness, which a lot of people tend to have. So if you have that or you know someone who has that, please get them to watch this video because it could potentially change the direction of what they're going through and get them through this a lot faster than what they might already be doing. So I hope that was helpful. If it was, let me know, but we'll see you in the next one.